conspire to lie and mislead the American people. That's right, conspire. Joining me now from Atlanta, physician and former Secretary of Health and Human Services, Thomas Price, M.D. Mr. Secretary, I just can't remove the political component here. Whether you like Dr. Fauci or not, whether you agree with this guy or not, when you step back and look at the big picture, if this were happening under Barack Obama, the COVID-19 event, if this happened under a, God forbid, President Biden, I know in my heart, right down to my toes, that this government response, this over-the-top mandate, mask-wearing, shut down the economy, shut down the constitutional rights of tens of millions of Americans would not be happening. You agree with me?
I think that's accurate, Graham. Thanks so much. Good to be with you. We actually have a model for that, and that was the swine flu about a little over a decade ago. And significant disease in our country, significant number of mortalities, but you never had this kind of response. Now, the difference, I believe, is that we're watching right now in real time in our society and literally across the world how public health tracks a new infectious disease. We're not used to it. It's got all sorts of uncertainties and unknowns. It's got fits and starts, got successes and failures, and that's what's concerning to folks. But that doesn't mean that you keep the society shut down. It means that you have to be cautious and careful about what you're doing, have to take appropriate precautions, identifies those populations that are at greater risk, make certain that they're being protected, but you got to get on with life, and that's what's important to talk about.
What do you expect, Doctor, when you lock people up for 3 months in the spring? I'm talking March, April, and May, and then suddenly you say, okay, go out and live, especially among the young people, right? What's going to happen? Yeah. You're going to have more cases, and then compound that with testing more, testing these people. And by the way, we should point out that when you lock people up and don't expose them to outside sources, that would be other human beings and just the elements, their immune systems are going to plummet, and so that makes people more susceptible to any virus. Would you agree with that?
Well, I don't know if there's any evidence that the immune system decreases that rapidly in terms of its ability to function. But what hasn't been talked about are the people who have not accessed the healthcare system, who have diseases and challenges other than COVID-19. And those individuals, the death rates are going up, and the lack of diagnosis of cancer incidents, and on and on and on. So we're going to see a significant spike in deaths from and disease from other sorts of things because folks haven't accessed the healthcare system. So we've got to get on with life. We've got to be cautious about what we're doing in terms of those vulnerable populations. But that doesn't mean that you shut the country down. It means that you do the right thing and do it responsibly.
All right, so let's talk about some truths here, shall we? How about truth number one? And this is regarding the number of hospital stays and the number of patients in the ICU. There is an underlying beat among the mainstream media and among the Democrat Party that we have this surge in patients going into both hospitals in general and to ICUs. I'm looking at a chart right now, Secretary Price, that says exactly the opposite, that the numbers are going down and that this thing peaked in April.
Yeah. It's important to appreciate that because it's a new infectious disease, at the beginning of all this, we didn't know what that curve was going to look like.
Right.
But now we have a lot more information. There's a local hospital close to where we live in Atlanta. Over the weekend, it had two COVID-19 patients in the entire hospital. Now, that doesn't mean that you let your guard down completely, but it means that you can begin to go on with life and begin to do the kinds of things from a healthcare standpoint that need to be done to protect people and treat people for other types of diseases.
All right, let's look at truth number two. These are Graham's truths, but they're facts. Truth number two, and this has to do with deaths per day. Again, clearly you see, when you look at the chart, there is a downward trend. This is deaths per day. And so what we've seen here, Secretary Price, seems pretty clear to me, is that we had a virus work its way through our society, and this is an opportunistic virus, right? It seeks out the weak and folks who have comorbidities and maybe the very elderly in our society, and that's why these nursing homes were hit so hard. So it's run its course through the vulnerable and is now running its course as a regular old virus through a typical society.
Yeah, that is indeed true. However, there remain vulnerable populations. So you can't
Sure.
take your guard down on those vulnerable populations. And nobody's promoting that. Nobody is promoting that. What we're promoting is responsible activity in the face of a new infectious disease. We're seeing more testing, as you have said and the president said, which decreases the mortality rate because you got more tests. Over in South Carolina this past week, there were football players, 25 football players, I think, that tested positive. All of them asymptomatic, none of them having any symptoms at all. But that's just what's happening all across our society, that we're testing more individuals. So you're surveilling and getting more individuals that are positive but aren't necessarily symptomatic. That doesn't mean that they ought not be cautious in terms of those vulnerable populations.
Sure, but this is what we call herd immunity developing in our society right now, which some Western cultures actually subscribe to during this COVID-19 episode. So let's look at truth number 3. Florida. Florida is getting a lot of attention right now, and the mainstream media is saying, oh no, look at all the spike in cases in Florida. Well, again, there may be more cases out there, but when you look at the median age of who's being infected by the Wuhan coronavirus right now, clearly that median age is lowering, and this again goes to herd immunity, and it also goes to the fact that the virus has worked its way through our society. And then when you look at fatalities per day in Florida, again, it mirrors the trend overall in the United States. It is dropping. And the bottom line is this: the more and more research we know about this virus, at least in our society, the vast majority who contract the Wuhan coronavirus are not going to die.
Absolutely. In fact, a huge majority are not going to die. The vast majority of individuals likely don't even know that they have it unless they've gotten tested. The vast majority will never require any treatment other than over-the-counter kinds of treatment. It's about 10 to 15% of folks who require more treatment, about 5% of folks who actually require hospitalization. But those numbers continue to go down in incidence as you test more. So
Right.
the end of this virus, the story of this virus, has yet to be written. But I believe, as you mentioned earlier on, that it's going to be a virus that is going to have a mortality rate somewhere around the seasonal flu,
Yep.
maybe a little greater, but certainly not the 10, 20 times that was predicted early on by some
That
individuals.
was predicted by folks like Governor Newsom in California. And I would ask the people who live in California to look at the numbers right now. The cases are spiking in California. The numbers are going up, yet the governor is, quote, reopening the state. That should tell you right there that virtually none of this is based on the science, and everything is based on the politics of it and how it will affect the outcome of the November election. Secretary Price, thank you. Coming up next, the internal anti-civil attack on our own